HESI Exit Medical Surgical Nursing, Mastering the Gastrointestinal System. Introduction. Welcome to our comprehensive review of the gastrointestinal system for the HESI Exit exam. In this session, we'll explore understanding GI anatomy and physiology, recognizing common GI disorders and interventions, applying critical thinking in GI emergencies. This system is vital because GI conditions significantly impact digestion, absorption, and elimination. Nurses play essential roles in early detection, prevention, and treatment. GI system anatomy and functions. Let's examine the gastrointestinal system structure. Main digestive organs: mouth, esophagus, stomach, small intestine, large intestine, rectum, and anus. Accessory organs: liver, gallbladder, and pancreas. Primary functions: food digestion and nutrient absorption, metabolism and waste excretion. Important GI diagnostic tests. Key tests for gastrointestinal assessment. Laboratory tests: liver function tests, AST, ALT, and bilirubin levels. Pancreatic enzymes, amylase and lipase levels. Stool analysis, occult blood testing, ova and parasites. Imaging studies: abdominal X-ray, CT scan, MRI, identify blockages and tumors. Ultrasound, detect gallstones and liver disease. Endoscopic procedures: upper endoscopy, views esophagus, stomach, and duodenum. Colonoscopy, screens for colorectal cancer and polyps. Gastroesophageal reflux disease, GERD. GERD occurs when the lower esophageal sphincter weakens, allowing acid reflux. Common symptoms: heartburn, regurgitation, chronic cough, and hoarseness. Nursing interventions: lifestyle changes, avoid spicy foods, eat smaller meals, elevate head of bed. Medications: proton pump inhibitors like omeprazole, H2 blockers, and antacids. Peptic ulcer disease. Peptic ulcers have several causes and serious complications. Primary causes: H. pylori bacterial infection, NSAID use, stress, and smoking. Symptoms to monitor: epigastric pain, nausea, bloating, and black tarry stools. Serious complications: ulcer perforation and hemorrhage. Nursing interventions: medications, proton pump inhibitors, H2 blockers, and antibiotics for H. pylori. Lifestyle changes: avoid alcohol, caffeine, and smoking. Gastrointestinal bleeding. GI bleeding requires immediate attention and has different presentations. Upper GI bleeding. Causes include peptic ulcers and esophageal varices. Symptoms are vomiting blood and black tarry stools. Lower GI bleeding. Causes include diverticulosis, colorectal cancer, and hemorrhoids. Symptoms include bright red blood and stool. Nursing management. For fluid resuscitation and blood transfusion if needed. Nasogastric tube placement and vital sign monitoring. Monitor hemoglobin and hematocrit levels. Inflammatory bowel disease. IBD includes two main conditions with different characteristics. Crohn's disease affects the entire GI tract with skip lesions. Symptoms include diarrhea, weight loss, and abdominal pain. Ulcerative colitis affects only the colon with continuous inflammation. Symptoms include bloody diarrhea, urgency, and fatigue. Management for both conditions. Medications, corticosteroids and immunosuppressants. Dietary changes, low residue, high protein diet. Other common GI disorders: irritable bowel syndrome, chronic functional disorder with altered bowel habits. Symptoms include abdominal pain, bloating, diarrhea, or constipation. Triggers are stress, certain foods, and hormonal changes. Management includes high-fiber diet and stress management. Appendicitis emergency condition. Appendix obstruction leads to inflammation and rupture risk. Symptoms are right lower quadrant pain, nausea, vomiting, and low-grade fever. Pre-surgery care includes keeping patient NPO and 4 fluids. Post-surgery care focuses on infection monitoring and early mobility. Diverticular disease. Diverticulosis. Small pouches form in the colon, usually without symptoms. Diverticulitis. Inflamed diverticula cause fever, left lower quadrant pain, and diarrhea. Management approach. Acute phase, keep patient NPO, give 4 antibiotics, and control pain. Long-term prevention, high-fiber diet, avoid seeds and nuts. Bowel obstruction. Bowel obstruction can be mechanical or non-mechanical. Mechanical causes: tumors, surgical adhesions, and twisted bowel. Non-mechanical causes: paralytic ileus and neurogenic factors. Symptoms include abdominal distension, cramping pain, vomiting, and absent bowel sounds. Nursing management. Keep patient NPO, insert nasogastric tube, provide 4 fluids. Prepare for possible surgery. Liver and pancreatic disorders. Cholecystitis, gallbladder inflammation. Caused by gallstones and bile duct obstruction. Symptoms include right upper quadrant pain, nausea, vomiting, and Murphy's sign. Treatment involves keeping patient NPO, for fluids, pain management, and possible gallbladder removal. Hepatitis. Caused by viral infection, alcohol, or autoimmune disorders. Symptoms are yellowing of skin, fatigue, right upper quadrant pain, and dark urine. Management includes supportive care, antiviral medications, and vaccination prevention. Pancreatitis. Caused by alcohol use, gallstones, and high-fat diet. Symptoms include severe stomach pain, nausea, vomiting, and elevated digestive enzymes. Management requires keeping patient NPO, for fluids, pain control, and low-fat diet. Advanced GI conditions. Cirrhosis and liver failure. Results from alcoholism, hepatitis, and fatty liver disease. Complications include fluid accumulation, bleeding varices, and brain dysfunction. Management involves monitoring ammonia levels, lactulose therapy, and sodium restriction. Colorectal cancer. Risk factors include family history, high-fat diet, and smoking. Symptoms are blood in stool, weight loss, and changes in bowel habits. Screening uses colonoscopy and fecal occult blood testing. Treatment includes surgery, chemotherapy, and radiation therapy. You've successfully reviewed the essential gastrointestinal system concepts for the HESI exit exam. Remember that early recognition of GI emergencies is critical for positive patient outcomes. As nurses, we play vital roles in patient education, nutritional support, and preventing complications. Keep practicing these concepts and applying critical thinking skills. You're well on your way to success on your HESI exit exam. Continue your excellent work in nursing studies.